This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance, sponsored by Modern Practice Solutions. My name is Olivia and I'll be your moderator today. Today's episode was put together by our very own Terri Walker on the topic, are you making your patients sick? While most patients and dental team members aim to keep their patients comfortable during a dental procedure, the paramount concern is whether the patient would experience illness after their dental treatment caused by the dental unit waterlines. So, Terri, before we interview Caitlin, would you like to talk a little bit about the history of dental unit waterlines?
Yes, that's a very interesting topic. In 1969, G.C. Blake discovered the connection between bacteria and waterlines and infections. So even after 6 decades of awareness, it's very disheartening that only 20 to 30% of the dental offices still do not adhere to established testing protocols and maintenance practices. So research reveals that while pond water harbors approximately 100,000 CFUs per ml, some dental unit water lines actually have alarmingly high bacteria counts that are similar to pond water levels. The EPA mandates that the dental unit water lines must be maintained at levels below 500 CFUs per ml. So each office should have a written protocol for testing, maintaining your dental unit water lines, and also accompanied by precise documentation of each task.
So, Terri, I like how you emphasize that there should be a written protocol because, as you mentioned, 20 to 30% of the dental offices are not in compliance.
Correct.
And if they are in compliance, do they actually know how to do it? Because that's one of the tricky parts. There's so many different product lines that they can choose to use. And so what are they using and what's the IFU, the instruction for use on how to use that product? So we really encourage practices to have this built into your infection control plan or have a standalone dental unit waterline policy that goes over the procedures. And we're basically going to summarize some of that for you. Let's talk to Caitlin about testing. You've served as a hygienist and now as a compliance trainer, you've actually tested water while you're in a dental office. So can you speak to us about testing, Caitlin?
Yeah, so you can't tell the CFU, which is colony forming units per milliliter, just by looking at the water. The only way to know what your concentration is to test the water. Again, we're testing to make sure that that concentration is less than 500 CFUs per milliliter. Initial testing should be completed monthly, so test all lines in all operatories monthly until you achieve 2 consecutive months of passing tests. Once that happens, you can then move to quarterly testing. If the water lines are passing, so if you have a passing test, you're good to proceed with your regular water line maintenance. So maybe you're using a tablet or a straw or a cartridge. Just keep doing what you're doing if you're passing. If you do not pass, you will want to follow the manufacturer's instructions for your treatment product. And typically, that procedure is going to be to shock your water lines. You'll then retest, but make sure you wait the allotted amount of time before retesting. Each product is slightly different. You may need to wait a number of hours or days before retesting.
Thank you, Caitlin, for covering that. So that's valuable information for our listeners to incorporate about testing. Because I can tell you from the legal standpoint, if you ever sued for malpractice over a dental unit waterline issue, you can't say, oh yeah, we tested our water. It's all about the proof. Where is the proof? And if you're using paddles, we don't want to just check the box. We encourage you as a company to take digital photos of those paddles and to be very specific in your documentation. And that's accomplished also with your lab testing, where lab gives you the exact microbial count, which is a good way to have a baseline established with your testing program. And as you said, Caitlin, we can't just look at the water and know. But shocking, as you mentioned, that's an important component. So Brenda, can you talk about shocking and how that works?
Absolutely. So shocking the water lines is such an important step in our dental unit water lines process. This is the process that efficiently eradicates or removes the bacteria in the biofilm from your dental unit water lines. You'll be selecting a shocking product that suits your office's particular needs. And these products are available in many forms. They are available in liquid form, tablets, cartridges. So it's important, whichever method you choose for your practice to shock your dental unit water lines, that you're adhering to the manufacturer's instructions for use for the particular product that you've selected. After shocking, again, as Caitlin mentioned, we want to allow at least 5 days before retesting.
Great information. And I really encourage listeners that, whatever product line you're using, please make sure you look at the protocol and then adapt it to your infection control plan, or, put a copy on the inside of a cabinet door just to be sure everybody is following those instructions properly. So Terri, let's get back to you about maintaining the water lines. We've learned about testing and shocking, but what are your suggestions about maintaining water lines?
Maintaining your water lines is essential due to the fact that you've shocked it and your lines are clear, but how are you going to keep them clear until your next shock? So think of your water lines as a swimming pool. You open it in the spring, you shock it, and then you put chemicals in it to maintain that. So in your dental unit water lines, you want to use a maintenance product, again, available in a tablet, liquid form, a straw, or a cartridge. The maintenance products just helps maintain that clean water line. And then you also want to remember to flush your water lines for 2 minutes every morning, and then conduct a 20 to 30-second flush in between each patient. And then the important part is documentation. Like we discussed before, if it's not written down and not documented, then you're going to be assumed that it was not completed.
So true, Terri. So this is a valuable topic for our dental personnel, our team members. I would love for everyone that works in a dental office to be ambassadors for promoting dental unit waterline quality water that we're using to assure that the safety of the patient is never compromised. And by embracing the protocols that we've discussed, your dental office can actually pave the way for that safer environment, fostering trust with your patients and well-being for not just your patients, but also for the team members. So thank you everyone for participating in today's episode, and we look forward to seeing you next week.